I think it's a really interesting policy environment. I mean, it has massive implications for people's well-being. For many people, it's a value discussion.
I think because of that, people see it as less of an economic development indicator than maybe it should do.
These policies have been very effective and people really are asking for them. So maternal mortality is one of the reasons why there's these chunk of missing women. You're just sort of accepting massive rates of death.
Hello, and welcome back again to this episode of the Marginal Babble podcast. In today's episode, I sit down to talk with Professor Damien Clark out of the University of Exeter to discuss abortion policy and how it affects economic indicators of a country's development. Professor Clark is an associate professor in the economics department of the University of Exeter and the University of Chile, is a research fellow at IZA, and an affiliate of the Millennium Institute for Research in Market Imperfections and Public Policy. As ever, reference research material is included in the description down below, and without further ado, let's get into the episode. Enjoy.
The reproductive sort of healthcare environment, I'd say, over the last decades, is, if you sort of look, it's sort of generally been towards opening up. I think many people have in mind these particular emblematic cases. So I think, the recent findings of the US Supreme Court where they've restricted access. Maybe people are like have in mind their own particular country's reforms. So you have sort of this idea that there've been many reforms. So you'll often see in the press discussion of abortion reform, discussion both in a progressive way and in a less progressive way. But if you look at the overall data, in general, reforms, they happen quite a lot. So like around 2 or 3 countries per year on average over the last 30 years have made substantive changes in access to abortion. Here, I mean like induced abortion, where people can either request under certain grounds or more or less freely. And those movements in general have been towards opening access. So I guess of around 60 or so reforms, something like 50 national level reforms have been to increase access. And here often you'll see like access is limited to certain characteristics. So for example, it might be that abortion's not allowed in cases of rape, for example, but is allowed in cases where it would save the mother's life. And so what you might see is some country sort of progressively steps up a little bit, saying, okay, at the beginning maybe abortion's completely not allowed, which actually is still the case in 4 or 5 countries. Abortion's not even allowed to save, say, the woman's life, or in cases of fetal inviolability. But then you'll generally see countries sort of increase progressively, maybe first opening up cases where maybe there's fetal inviolability or where the mother's at grave risk for her health. And then over time, you often see that countries move towards sort of abortion being available upon request with some certain limits, or maybe during the first trimester or up to week 18 or week 12 or whatever. So in general, there's a lot of reforms, 60 odd over the past 3 decades. They're generally moving towards being more progressive when you look at national level reforms. But then there are obviously cases where the access is sort of being decreased. So the US is one very particular case. Poland is another case where access is decreased. And then there's been a sort of a recent move in Latin America towards increasing access. I think the funny thing, and maybe the last thing I'll say on this is, you'll often see that these reforms within a particular country, there's an ebb and a flow. So maybe there's a progressive movement. People have greater access to these kind of contraceptive options, and then later access is restricted. So there's not a clear linear progression in these policies.
Yeah, and that's the curious thing, because you talk about there how it's generally moving over time in the direction of being more progressive. But obviously, as you quite rightly mentioned, things like Roe v. Wade and are quite popular examples of instances where it's been less progressive and it's been moved to a more conservative basis. And just from reading, obviously, like the paper that you were involved with and some of the other work that you do, there seems to be quite a high level of volatility compared to other types of economic policy, whether it be monetary or what have you. I'm just kind of curious of what the reasons really are, or what potentially you think the reasons are for it being such a volatile area of policy. So and of volatility obviously indicating that it goes progressive and then it goes more conservative, and then it goes progressive and more conservative, even within the same country over maybe a 20, 30, 50 year time span.
Yeah, I think it's a really interesting policy environment. I mean, it has massive implications for people's well-being. So I think there's like, you want to be careful not to like, or I want to be careful not to like academicize it too much. But I think it's like really interesting to see with abortion, or say there's other policies like say monetary policy, the one that you mentioned, where really it's sort of a technical discussion. So I don't know, we learn some new fact. I don't know, the historical example of monetary policy, the Taylor rule, and so then countries have this idea, oh well, now the optimal thing is to do this. Whereas I think with abortion policy, people know the facts. I mean, the paper we'll talk about later is sort of improvements in women's health, but it's not generally such a fact-based discussion. It's much more sort of a beliefs-based discussion. And I think this is also where it gets a little bit complicated to work on this in an academic sense. I mean, you can know the costs, you can know the benefits. So you can know, if you open access to abortion, people are more able to time their births, maybe do things that are better for them, have improvements in health. But then there's for many people, it's a value discussion. And so if you have certain politicians who have the right kind of leverage, then really rather than making a decision based on technical discussions, they'll make the decision based more on value, on sort of their values and their perception of their electorate's values. And so I think this is one of the reasons why you just don't see a linear progression, because you may see all the sort of momentum. So I mean, the US is a very interesting case. The momentum for many, many years since Roe versus Wade was to opening access, even at times to provide public support for it. And then suddenly there was sort of a number of institutional changes within the Supreme Court, at sort of at state level, and at national level. And then suddenly sort of the I guess the weight of the values of the institutions changed in a way that then the policy changed. And this I don't think you would ever see in, I mean, maybe a little bit in tax policy and monetary policy, but in abortion policy, I think it's really particularly salient, the sort of the philosophical discussion.
Yeah, and I think personally, I think that's kind of I think a big part of it is, as you quite rightly mentioned, there's a level of morality or differences in morality and culture and things like that in this discussion compared to something like monetary policy or taxation policy, which really kind of is just I don't know, very empirical. Like you're trying to achieve an objective and you're trying to change things, sure, up and down, left, right, however you want to, but the goal is to get like a certain level of output or the most maximized level of output. Whereas I think with something like this, it is it's very politicized, whether if you're religious or not, or whether just whether the cultures you come from as well. So I think there's a kind of an instinctive morality component to it as well, and people differ on those values, of course. What I do think is quite interesting, though, is I think because of that, people see it as less of a economic development indicator than maybe it should do, compared to something, let's say, like health rates or like the average age of death and things like that. Could you talk a little bit about how abortion policy and reform and different policies factors into a country's economic development potentially and how it affects it?
Yeah, and actually I think this is probably one of the roles of a researcher in this area. It's like, well, if these are value-based judgments, at least we need to know sort of at least we need to have in mind what the costs are, and I think there needs to be some level of realism, right? So for example, you might say, well, I'm really against abortion, but then if you have the information at hand that actually rates of abortion don't change that much when you legalize things, but the safety of the procedure changes. I mean, there's clandestine abortion, there's sort of public abortion, there's safe abortion, and I think like having these details at hand can really help shape the narrative and help people sort of line up maybe their own value judgments with actually the sort of the empirical facts, which actually in this case I think are quite useful. So I guess the point that you raise on development, we're quite lucky in economics to have evidence for many, many years. So I guess there's been papers on very high quality papers on abortion coming out for I mean, looking at context since even the early 1900s, but really over the past 30 years there's been a big movement to sort of doing high quality policy analysis, and abortion is really an important theme. I mean, the recent Nobel Prize winner, Claudia Goldin, part of her agenda, not abortion but the contraceptive pill, so there's like a lot of sort of work on this, and a lot of the things we've learned have really been quite informative, beyond say pregnancy rates and beyond maybe even things like health, you really see that abortion reform can do good things for people. I mean, obviously, making the decision to abort is not something people do lightly, and they're doing it because I think they're thinking of. I mean, it's a hugely complicated calculus, but thinking about how can I balance my desires to have children with also the knowledge that if I have children at a time that's not optimal, potentially I'm not going to be able to invest as much in the children as I'd like, or there's sort of career concerns that if you have an undesired pregnancy at 20, maybe actually you really want to have children, but it's really complicated for you in terms of, I don't know, you just don't have the money, or you're developing human capital, you're in school, you're in university. And so I think one of the things we've seen from a number of contexts, there's like a really nice paper from Norway that looks at legalization of abortion in Oslo and not in the rest of the country. And they show that women many years later in Oslo have managed to gain more education as a result of the policy. Even they show impacts on children's well-being. So if people are more able to optimally time their births, they're more able to invest as much as they'd like in their children. So in some sense, you invest in your career, you get to a more stable point. You give birth, and actually in this particular Norwegian case, it's interesting because you don't see any change on the total number of births. What you see is people are changing the timing of the birth. So instead of having birth, say, in their teens or in their early 20s, when it might be very complicated, maybe they don't have the relationship they wish. They're probably not on a stable footing in terms of their home life, their income. And so what you see is people don't, or abortion reform doesn't mean people having less births. It just means they're having better times. And consequently, they're investing more in themselves and investing more in their children eventually. And this really has an important impact on development.
Yeah, that's actually really curious. Wasn't aware of that. The idea that actually having certain abortion policies in place and freedom in that regard doesn't actually affect the total number of births. It really just sort of spreads them out over time into like more optimal scenarios for the individuals. Because one thing I was actually going to bring up potentially as well was demographics, particularly in the Western world.
Yeah.
Because potentially what you would think is if you had more free abortion policy, this is just from sort of a high level thinking without, an external perspective, if you hadn't done a lot of research in this regard, is that if you had more abortion policy, that would potentially affect the fertility rate, and potentially you would have a lower fertility rate in terms of births per woman being, less. And something we are seeing now in the Western world is actually the birth rate is dropping below 2.1 quite significantly. And so we're actually below replacement rate. I think Japan, the UK, Germany, all these replacement rates, I think, are in around sort of 1.7, so quite considerably below, and they're only going to get lower.
Yeah.
And so what you might have, and what a lot of people are actually calling for, is people had to have more kids so that we can balance out the population, because what you end up seeing is a situation where you're very top heavy in terms of age demographics, and suddenly there isn't the dependency ratio as often. You don't have a lot of younger people being able to pay into the system, the government system, to actually pay for both the children in that system and also the elderly. There's more dependence. Kind of what you're actually seeing in France not too long ago, right? They're looking to increase the retirement age because, quite frankly, there's, people are living longer, and they need to increase the retirement age to have less dependence in that system. But it's actually quite interesting to see that it doesn't seem to affect that. Do you have any reasons why that could possibly be?
Yeah, I mean, I think an interesting thing about the abortion literature is that really every particular case is so sort of special, so ad hoc, that I don't think. So I wouldn't say. I mean, Norway, I think, is a very interesting case where you don't see long-term impacts on actual birth rates. I guess a tricky thing in really nailing down these questions correctly is you need to have abortion reform that happened a long time ago. You need to follow it over a long time period, and you need to sort of have some way to capture sort of affected cohorts and non-affected cohorts and see what happens at the end of their life. Because what you often see, and I think what's easier to estimate, is, okay, abortion or reform occurs. In the years after reform, there's less rates of teen pregnancy, less rates of birth among younger women. But does that actually translate into changes in completed fertility? That's something that it's much trickier to follow up, and there's not a huge amount of studies doing that. So the Norway one is I think one of the leaders here. There's a recent paper in Spain where they seem to find something similar. No massive increase no massive change in cohort size, But I definitely wouldn't say this is an empirical fact, because there are cases. So, for example, I think one of the probably the strictest abortion policy changes that I know of was Romania in I think the 60s or 70s. The sort of the dictator took over, and precisely for the reasons you say, Romania was a case where there was many abortions, and the dictator said, well, was very concerned about demographics, and from night to day, or from one day to the next, just made abortion completely illegal and really very highly penalized. And what you see is that it had a massive impact on fertility, and it did increase birth rates quite substantially. So completed birth rates, when you follow these cohorts many years later. And this is actually a context that's also been studied quite well. So in certain settings, you don't see there's an impact on completed fertility. I don't think that's necessarily a empirical fact that goes across the board. My feeling is today we'd probably be closer to the sort of this experience from Norway. Firstly, because it's easier these days to access abortion, whether it's legal or whether it's illegal. There's a lot of sort of self-medicated abortion, and I guess more generally, I guess you sort of want to separate the sort of the issue of demographic decline from abortion. I think like we should certainly be concerned in some sense if countries are very rapidly falling in size for precisely the reason you mentioned. I mean, social security systems are gonna start to be really stressed. Pension systems are going to be very stressed. But I think if this is the concern, probably I would argue that sort of obliging people who don't want to give birth isn't the way to sort of bump up fertility from 1.6 to 2.1. Probably you want to look at sort of the deeper causes of why fertility over the past 30 years has declined from 3 per woman in many countries to under 2.1. And I think it's probably not because of contraceptives. It's probably because people just want less children. I mean, if it's very expensive to have children, if you have to spend a lot of money to educate your children, if you're concerned about the sort of the sustainability of our lifestyle, I mean, this I think is probably a much bigger determinant of falling populations rather than just this contraceptive access. And I think actually there are many policy decisions that could be better, both in terms of encouraging certain I guess not sort of making people who don't want to have births pay the cost to increase fertility.
Yeah, and I think there's a lot of moral questions when you start going into like, oh, right, we're going to shut down abortion just so that we have an increased birth rate. One, it doesn't actually seem that actually occurs in every scenario. It's very environmentally predicated, and and the preconditions for that policy and how the policy is implemented. But generally speaking, like you say, it doesn't seem to affect it. And second, it's very morally ambiguous, quite frankly, to basically tell people you have to have children and what they want to do with their own body, quite frankly, again, which comes back to the abortion debate as well. I think in that regard, there's incentives and things that they can do. Obviously, put in place things like child support payments and things like that, because like you say, one of the big reasons why I think people are concerned not to have as many kids is quite frankly the cost of being able to maintain their lifestyle without making themselves considerably poorer. Quite frankly, how things like housing and things like that is a big concern. So I think that's a better way to go down in terms of like child support payments and things like that. With that in mind, though, I think what we're really good to talk about is the decriminalization of abortion reform, particularly in regards to Mexico that you studied in your research. I was hoping that you could just give me an outline of what happened in Mexico in 2007 and what were the preconditions to them decriminalizing early term elective abortion.
Yeah, I think Mexico is a really interesting case, and in general, it sort of followed a similar path to a lot of countries in Latin America recently, where it really feels like it's sort of been reforms driven by individuals. So like there's been a big sort of feminist movement in Latin America, these like the green handkerchiefs that have these like sort of the green kerchief, which is the sort of the symbol for abortion reform. And you've seen this has had effects in Mexico, Uruguay reformed abortion, Chile partially, Argentina. They've been like this sort of particular case was really very, I guess, bottom up. That it was sort of a civil society was pushing for it. There was lots of ONGs that were working quite tirelessly to increase access, and eventually, in the Mexican case, one state government, the government of the federal district, took up the cause. I think like largely sort of at the behest of its citizens, and reformed access to abortion in quite an abrupt way. So it was, I guess, the same as Romania. That one day it wasn't available, the next day it was. I mean, of course, it was available pre-reform. It was just available in a way that people are doing it in a risky way, using drugs they buy, maybe even off WhatsApp or in pharmacies without appropriate sort of knowledge. So there was this reform which increased access to abortion up to I'd have to confirm the week, but let's at least week 12, if not later. And it could be done on any ground. So it wasn't like the woman needed to, for example, I don't know, demonstrate economic need or demonstrate that there was some sort of serious medical concerns. And so this was a big abortion reform. It increased access quite considerably, and it was the only state within the country. There's 32 states in Mexico, and the federal district initially was the only state to make this policy change. Over time, what we've seen is there's been sort of follow-on effects from this, and now more recently, actually, there's some suggestion that the whole country might legalize abortion.
I see. So that's an important distinction to make. So it appears though it's just a localized region in Mexico that has decriminalized it. That's correct.
Yeah, in 2007 it was in the federal district, and actually what the federal district did, and often you'll see that when there's these sort of sub-national abortion reforms, there'll be limits. So you must live in a certain state, but the federal district didn't put in these limits, so you could access abortion in the federal district even if you were living in other states. Of course, if you're living in the far north or the far south, it's not there's going to be economic barriers. But yeah, it was a locally isolated reform in the federal district, and what you saw is that it increased access a lot for residents of the federal district, and also it increased access for residents in nearby states.
Okay, interesting. So what was your research looking to examine in regards to this reform specifically? What was the aims and the objectives of the research?
Yeah, I mean, I think the question is quite simple, and it's one you would think we would probably know a lot about, and it's just what happens to population health, particularly what happens to women's, I guess you could broadly call it, reproductive health, when you legalize abortion. And we sort of started with this very particular, I guess you could almost say, like, model in mind, that often in the absence of abortion, what you see is that people, they still, often they're in situations where really they just can't have another child, or they can't have a child, and so they do need to access abortion somehow, and so they do it in a clandestine way, and that is far riskier than if you go to a clinic and are supported by medical practitioners. So we were essentially just trying to quantify what's the effect of abortion reform on women's health. And incidentally, it's sort of a question that is, I think, highly policy relevant. So often you'll see claims by policymakers when they want to change, either increase access or reduce access. They'll say, well, it's better for women's health, or they'll even say, well, it's actually worse for women's health. For a while, I think during the Bush government, the White House, there was like a claim on the White House website that when women access abortion, they have elevated rates of breast cancer years later, which turned out to be, it was debunked. It was a false claim. But there's sort of this argument that one of the reasons why we legalize or we restrict access to abortion is because of women's health. But then we were looking across the literature, and really anything that was known was either from very small case studies or sort of correlational evidence, and we really wanted to sort of take a big crack at answering this question in a causal way. And the Mexico example was quite convenient because we had one state that had the policy change, and 31 sort of, I guess you could say, control states.
Yeah, it's just interesting, isn't it, how you look back over the last sort of, maybe if they call it 50 years, and things that we used to pronounce and proclaim were done and for reasons for health claims were obviously turned out to be the opposite. I mean, the biggest one I can think of when it comes to mind is smoking. People used to literally say that it helps with the nerves and things like that, and that they encourage smoking years and years ago. But obviously now we know it's probably one of the worst things you could possibly do for your general long-term health, right? And it sounds though it's the exact same with some of this abortion policy as well, which is, again, it's a little bit saddening, unfortunately, but hopefully we're moving in a direction where we have better information in regards to these things, and hopefully that's an indication of that. So
Yeah.
what were the findings of your research then? What did you find out, and what were the conclusions you were able to draw?
Yeah, so I mean, what we had, I mean, I guess we asked, so we sort of first wanted to actually validate that this abortion reform had an impact on, say, rates of fertility. And so what we did was we collected a huge amount of micro data. So in Mexico, for example, we could observe every single birth that occurred from, I guess, the early 2000s to after 2010. Over 30 million births. We have something like 17,000 or 18,000 maternal deaths, which we get from death registries. And we have high quality hospitalization records, where in hospitalization records, you see the precise reason that the woman presented to hospital. And we see this for every single hospital in the country. I mean, it's not a selected sample. It's the entire sort of universe of hospitalizations. The only sort of selection is that people may not present to hospitals for certain things. And so what we looked at, I mean, firstly, we just sort of wanted to see if the reform reduces fertility, and as we've seen in many other cases, it does. I mean, in the short run, you see that fertility, particularly among young women, declines by something like 7%, and this is something you've seen in the US with Roe versus Wade, with similar effects in I guess in the various places that have been studied, Romania, in Norway, in Nepal. So we estimate around a 7% decline in fertility, which is substantial. So it does suggest that the reform was doing something to help people control their fertility. And I think the more interesting finding, and what was sort of novel, people didn't know before, is when you look at hospital rates, you see for certain types of hospitalization, which I'll describe now, but from sort of one day to the next, they just fall off a cliff. And this, obviously, you don't want to, when we look at hospitalizations, we don't want to look at all hospitalizations. I mean, we want to look at hospitalizations for a particular group. So first we say, all right, let's look at women of reproductive age. And then there are certain classes of hospitalization that aren't going to respond to abortion reform. So say you don't want to look at hospitalizations for car accidents, for example, or for maybe for cardiac health, or things like that aren't going to respond to abortion reform. So we look using these sort of universally approved codes, the ICD codes. We look at reproductive health causes. So this includes things like hemorrhage, or a class known as abortion-related morbidity. And what we see is that these classes in particular, they really decline by around 2/3. And so basically what we can quantify is when abortion becomes legal, the rates of hemorrhage in the population fall massively. And this hemorrhage is essentially people, they go to the pharmacy or from, I don't know, or from a friend or from WhatsApp or however they gain access to these drugs which are abortifacients. So misoprostol is an example. They're not designed necessarily to, actually misoprostol, probably the most common drug, is designed to treat stomach ulcers, but it has this sort of off-label effect of inducing abortion. And so they buy these drugs. They don't have complete information. I mean, you can get information online, but you essentially self-medicate, and you conduct the abortion in potentially unsanitary conditions, in conditions without access to medical care. And then eventually you have to present to hospital if things sort of go really wrong, like if you start to bleed a lot. And this in particular, we saw that when the policy occurred, rates of hemorrhage, so people just presenting to the hospitalization with dangerous levels of blood loss, declined massively. Similarly, this class of hospitalizations called abortion-related morbidity also declined. So basically, you're taking sort of abortion in a highly risky setting and moving it into a much more safe setting, and you see impacts immediately in population health.
Yeah, so it really does seem that there's a significant impact just on the actual health and well-being of women who are of those ages, things like hemorrhaging, as you said. Because as you quite rightly mentioned, a lot of these people, I think, from like the reading that I've done, would probably go about doing them anyway. They go about having abortion hemorrhages technically in a legal way, but in a home way where they don't necessarily have the knowledge, the expertise, and things, and the hygiene that you would have in a hospital environment, I think.
Yeah.
So I guess the follow up to that would be: was there anything else did you find in the research? Did you take it any further in terms of women's health, or were there any other conclusions as well?
Yeah, so I think, I mean, the policy, and I guess this also goes back a bit to what we talked about earlier, like what are the determinants of policy making? One particularly interesting or particularly maybe even worrying thing about the Mexican case was this sort of reform was seen as like a very sort of it was obviously politicized, and it was seen as sort of like a left-leaning reform in the central states and in the federal district, and so many other areas actually responded by increasing rates of increasing punishments for abortion. So there was like a backlash effect that they even though abortion was already illegal, they now wrote it they sort of defined life as occurring from conception, and so in theory it opened up the risk of being prosecuted for murder if you either helped with procuring an abortion or if you aborted. And so we look at that. What we found was that it actually didn't sort of, I mean, the initial feeling was perhaps this actually worsens women's health. What we found was that we didn't see any massive increases in rates of or actually no, it could have done anything. So I guess we had like some prior ideas, but when we tested empirically, we didn't see any major changes in rates of women's health, which suggests that perhaps people, if they really need to abort, they're going to do it regardless of these particular sort of policy shifts weren't really discouraging people from aborting. We didn't see any impact on fertility. We didn't see any impact on rates of morbidity. We also didn't see any impacts on rates of maternal death. So this was one of the, I guess, the other strands. We looked at the sort of the backlash policy effect. And then another thing we looked at, and this came in quite late in the paper, we sort of had the initial paper, and then there was sort of this follow-on agenda, or what happens to people's mental health, and we see some evidence suggestive that rates of postpartum depression decline slightly. I mean, all of this is sort of like a little bit less statistical power, so I think they're sort of less clear findings than the extremely clear findings which you see with reproductive health, but there looks to be a small decline in rates of depression in DF, in the federal district, after reform.
Has there been any counter legislation in regards to Mexico? Because obviously 2007 was a while ago. Has there been any specific counter legislation that's come in that's potentially affected these kind of rates? If it's not in Mexico, can you think of any counter legislation that's had sort of a difference of impact across the world?
Yeah, I mean, well, there was these like states. There was, I guess, something like 8 states in the year after the policy which adjusted their penal code. So that's this like the sort of I guess they call it the backlash effect. Interestingly, around 10 years later, a number of states sort of followed DF. I mean, it took a long time, but a number of states, I might be forgetting, maybe Hidalgo, but various other states legalized abortion and following a very similar sort of policy recommendation as Mexico, as DF, the federal district. And then we also saw, I mean, now recent discussions, and I think part of this is sort of the evidence that these policies have been very effective, and people really are asking for them. That in the entire country now there's a potential that abortion might soon be legalized nationwide. I think it's like subject to a couple of votes in sort of the parliament. Yeah. So this locally, there's been this reform. In general, you sort of often see that there's clustering of abortion policy changes. So I mean, the Latin American case, it's hard to say whether this is sort of like snowballing effects within countries or whether they're things that sort of developed alongside. So I mean, the feminist movement in Latin America has been very important over the last 10, 15 years in all sorts of dimensions. But one of the key things has been demanding abortion access, and then so in close progression there was Mexico. I mean, Uruguay was, I think, a little bit before Mexico, but when we were studying Mexico, I think it was Cuba, Uruguay, and Mexico were the only countries in Latin America which had abortion available, sort of broadly. And then since then, Argentina has now legalized abortion. Chile's sort of making movements in that direction. So there have been various other policy responses which it's hard to know if they're sort of responses to Mexico or to, you know, to Uruguay, to leaders within the continent, or the things that would have developed independently. But you do often see that these policies cluster in regions in a way that makes you think perhaps there's spillovers.
Yeah, it's interesting. So it seems as though, for the most part, there does seem to be a trend, particularly in Latin America, that it is moving generally to be more liberal in terms of abortion reform, due to potentially the results that have been found in Mexico, but also other places potentially across the globe as well. Has there been any significant impact on other economic development indicators? Because what I would like to understand potentially a little bit more is how maternal mortality rates could actually affect the wider economy at large. Is it affecting the education rates of? I think you mentioned it affected it allowed mothers to attain a higher level of education, which I'm presuming then allowed them to be more productive in terms of their economic output, which could potentially have an impact for things like GDP or GDP per capita potentially. I would also imagine if maternal mortality is higher, there would be less rates of potentially things like abuse and things like that within a household, because you have a two-parent household potentially. There's a range of factors that I think could tail off from this. Could you talk a little bit just about how maternal mortality affects other economic indicators and just the prosperity of a developed nation?
Yeah, so I think there's there's almost like two questions here. Is like, one, how does abortion reform affect maternal mortality, and then what the poor rates of health, or this particular dimension of health, so what do women dying in childbirth do to a country and to affected people. So I think maybe it's useful to like focus on the maternal mortality question in particular. I mean, my feeling is that this is it's like a policy embarrassment at the international level. If you look at rates of maternal mortality, even, I mean, there's good data running up to 2020 at the moment. So saying, I don't know, someplace like Norway, I think the lifetime risk of dying in childbirth is something like 1 in 40,000 people. So it's like one death per 100,000 live births. Where if you compare it to a country like Chad, which is I think one of the worst, it's 1 in 15. So you have a 1 in 15 risk of dying during your life in childbirth, which is just, I mean, independent of rates of economic growth. This is just sort of I think a policy embarrassment, and it's something that since the Millennium Development Goals, it's been a real goal that we've sort of professed. All right, we need to make maternal mortality decline. It has since the 1990s to 2010. It declined, but it wasn't even close to meeting the Millennium Development Goals. Now the Sustainable Development Goals, which is sort of the follow-on of the MDGs, has sort of planned a similar decline up to 2030 when the initial decline wasn't met. So there's sort of some question of how we're going to do it. And I think we know how we know what's necessary. It's just sort of putting it in practice is complicated. And obviously there's instrumental reasons why one would care about. There's reasons why, independent of their impact on development, why we would want to save people's lives. But then if you even just look at, say, for development, there are a number of sort of older papers looking at how maternal mortality rates increase, even, say, parents' investments in their children. So if I think there's a paper from Indonesia looking at the data in the 70s or the 60s, that if parents think their children aren't going to survive to maturity, they have less of an incentive in investing in their female children, right? And sort of maternal mortality, there's this idea, even from Amartya Sen, a Nobel Prize winner in economics, that in lots of countries there are these missing women, and so maternal mortality is one of the reasons why there's this chunk of missing women. You're just sort of accepting massive rates of death in certain productive sectors of the economy. I mean, obviously, independent of that, these are every person is important, and you want to save all these people. But if you're losing massive areas of your population, this has huge fallen impacts, to the economy. So these people aren't going to participate in the labor market. But think of the impacts of losing a mother to a child's development. This is the worst thing I think that can happen to a child, and interrupts their entire formation. So these are things that sort of generate scars that countries are going to be dealing with, not just in the year the event occurs, but really 20, 30. I mean, there's intergenerational impacts of these things, right? If children aren't getting the investments they need, they're going to be less likely to invest in their own children. So I think any policy that can bring about declines in maternal mortality just has a huge impact on well-being, and a huge impact on measurable sort of variables to capture economic development, both today and in a dynamic sense going forward.
No, I think it's a really, really important metric in terms of development amongst the nation. Is maternal mortality, and even education among females and mothers, I think, is actually really, really important as well, because they're in most environments, they're the individuals that are most connected with the children in terms of raising them, and it has a very long-term impacts if you take away the mother from that example, or have a less educated mother in that example about different things about the world, whether that be health, hygiene, development, education. It really, I think it's a very, very important indicator, probably one that doesn't get as much attention as it probably should, I think, in regards to economic development. But yeah, I think it's really sort of quite key. So following up from this research then, what would you like to see, or what research would you like to see conducted in the future to follow up on the findings of this research to sort of maximize its output?
Yeah, I mean, I think there's sort of like it's an area of active work. I mean, I guess we're lucky to know a fair bit about abortion reform, but there's lots of things that I think we don't yet know. One is sort of the number of case studies we have is relatively limited. So one could wish to know what happens in other settings. I mean, very recently a paper came out looking at what happened with women's health in the United States around Roe v. Wade, and they found that actually, I guess similar to what we found in Mexico, there were declines in maternal mortality, particularly among African American women, less so among white women. So I think there's sort of these broadening the findings, and also working out sort of distributional impacts of these things. Like, are there certain groups which are particularly sort of at risk when abortion's not available? And there's other things. Another recent study I saw, which I guess isn't work that needs to be done, the work that's been done, is some people looking at what this abortion reform did on rates of domestic violence. And this was something that I think before we didn't really know, these authors found that when abortion was legalized, rates of domestic violence fell. So it suggested actually like contraceptives or particularly abortion is an input into domestic violence, and sort of understanding the determinants of domestic violence is another really important literature. I guess the idea is people when they have access to abortion, they have more bargaining power. They can make better matches with couples. So I think there's various things that have come out since our work that have been really interesting. I think there's lots more that should be done. So one like very clean thing that can be taken up is just what's happened to these other states that have also legalized abortion within Mexico. Do you see similar effects? Like how sort of generalizable is this finding within Mexico, but also outside of the country? Another, I think, really interesting thing to understand, and something that I think is actually quite fundamental to the way we understand abortion, is how have the impacts of abortion reform changed over time. So if, say, you look at what were the impacts of abortion legalization on fertility in the 70s and in the 60s, with, say, like Roe versus Wade, they were probably very big, because there was really the external options were much more limited. You had to either go to a clandestine clinic, or you had to sort of required a lot of information. It required potentially quite risky procedures. Whereas today, I think the sort of outside option to abortion is self-medicated abortion. And so you see with the US reforms recently, there's really just a very widespread use of self-medicated abortion when abortion's not provided. So potentially the impacts on fertility are going to be much less, because either you provide it safely and people access it, or people go online and realize, okay, there's even organizations which send sort of pills in the mail to people, so people can still abort. You're just sort of shifting abortion from a highly standardized and safe setting to something which is much more sort of ad hoc and potentially risky. So what's the impact? One of, I guess, abortion when when you have these outside options. And I think this is just growing more and more, sort of understanding how people use outside options, and understanding whether these historical findings of declines in fertility still persist, or if really all we're seeing are just an imposition of costs with no real change on any of the variables people, I guess, the proponents of these policies seek to change.
Yeah, no, I agree. I think particularly on that health point, I would say is that I think sometimes what's not necessarily taken into consideration really is the impact of this policy, sort of more generally speaking. And so if you make it much more harder to get access to abortion rights, you're not just going to be decreasing the abortion rate necessarily. I imagine it would decrease it to some extent, and again, that depends on the environment, the culture, and things of that nature. But as you said, you've seen in the research, in many environments and cultures, it doesn't necessarily decrease it by all that much, and all you're doing is really shifting it from one place to another. You're just shifting it from your responsibility potentially as a government agency to something else, maybe the health organization or something else. And so I think that really just have to be considered. You're not removing the problem, you're just kind of shifting it to a different location.
Yeah, and actually I think this is maybe one of the ways where like economic research can really help sort of to try and untangle both a policy and sort of a values issue, because I think one complicated thing here is like really you can't, I think, question individual values. So there's people who don't believe that for all sorts of reasons that abortion is something that should be provided. But then really if this is sort of a philosophical point, and people say, all right, well, now we've made this policy, I feel satisfied that we're saying it's not provided, but actually what that's doing is it's not really changing access. So it's still, people are still using abortion, but what you're really doing is you get this sort of this warm glow for doing the policy that sort of lines up with your beliefs. It doesn't change anything, and it makes other people's lives worse. Then I guess you have to sort of ask yourself whether what you really care about is, I guess, more the sort of the value per se, or what sort of happens in practice.
Yeah, and this is almost like a bit of a strange way to put it, and I'm not even sure if I'm completely educated when I'm even talking about this, but when we talk about something like this, and you have it's really sort of values and morals or orientated, it's really hard to sort of pinpoint like what is the correct necessary moral value on this. Some people who are more pro-life will say, oh, no, it's moral and culturally we need to make sure that we don't have any of this. But then obviously people that want to have individual rights and things like that and the ability to have autonomy over their own bodies, will say something different. And I think it's actually sometimes quite hard to make governmental and economic policy based on those things. The thing that you can do much easier, though, is look at the results and data on things like health. Mm-hmm. And I think that's where a lot of the economics sort of comes into this. Pragmatically, what is the approach that's going to increase the health of our country, our nation, and things like that? And so sometimes I think it's almost and this may seem maybe apathetic to maybe some causes, and I'm not saying it's the right thing to do in every situation to take morals and values potentially out of it, but just that looking at the actual tangible implications on society, development, and things like that, it may seem apathetic or amoral potentially, but what it does allow you to do is take a pragmatic approach to actually hopefully better the citizens of your country, which at the end of the day, that is what governmental policy is meant to do, right? At least from a pragmatic standpoint.
Yeah, and I absolutely think, I mean, obviously researchers have sort of personal beliefs, but I think in research, I mean, a paper doesn't have any belief, any moral belief. And I think really what one tries to sort of provide with research is hard evidence. I mean, I don't think a research paper can ever say this is the correct moral, or at least on economics. I mean, in philosophy, perhaps. But we're not trying to impose certain values, and I don't think it would be correct for a research paper to start with the idea that this value is correct when certain people have other values. I mean, people have different values, and I think a massively important area or a massively important sort of idea in economics is that we respect heterogeneity, that people have heterogeneous preferences, and this is sort of built into our like the fundamentals of our I guess you could call it our social science. So I don't think a research paper can say anything about what the correct values are. I mean, it's not designed for that. But what it can do is say, all right, let's be pragmatic about this, and let's think whether our values or the sort of the policies we put in place are actually affecting the things that our values suggest we should affect, or if they're imposing costs that are potentially not initially desired.
Yeah, exactly. Research needs to be objective as opposed to subjective, right? And realistically, you can only sort of draw conclusions, hopefully, on objective data.
Yeah.
Yeah, so thank you very much for joining me and being willing to talk to me today. It's been a really interesting discussion in regards to how this and with economic policy and the different indicators for like economic development and things like that. Are there any things or pieces of research you would like to point people to if they've made it to this point in the recording? So that bits of work that you're working on that you would like to draw some attention to, perhaps?
I mean, I think if people are sort of interested in this area, there's really like a lot of really nice research they can refer to. I think there's there are particular researchers who sort of dedicate their career to these particular questions, or at least a big part of their career. So I mean, there's a researcher, Caitlin Knowles, who has a number of hugely influential and really extremely well done papers looking at the passage of abortion in the United States. I think this would be like a really nice starting place if one's interested in thinking sort of what a really good social sciences paper that sort of tries to unpick all these quite thorny empirical questions looks like. Incidentally, I've also been working on sort of a review of what economics can deliver in terms of the knowledge on abortion policy, and I have this handbook chapter, which is also potentially sort of a hopefully a reasonably broad and not too heavy introduction to the area. So I think these sort of things are quite useful, and hopefully this could be like a jumping off a point into all the sort of the great research that's out there on abortion from a range of scholars looking at the US case, recent US case, international. There's really a lot of really great work out there.
No, absolutely. I think they're great. It's a great stepping off point for people to go and do some sort of further detail and digging into the literature. Thank you very much for joining us, everyone. I hope you've enjoyed that. And until the next time, we'll see you soon.
Thanks very much, Max.
Thank you for watching this episode of the Marginal Babble podcast. If you've enjoyed this episode, please consider liking and subscribing down below and commenting any future topics you would like to see discussed. But until then, see you soon.